I've learned a lot about counseling because when you're dealing with people with mental health problems, usually they don't open up to you on the first visit. So for you to get to know about their mental health problem, you have to first talk to them from a humanitarian view. So as a lawyer, we are not really trained at law school on how to talk to people from that point of view. We are trained to be lawyers. But then from this mentorship, I've learned the art of talking to persons with mental health challenges, the art of counseling before actually being the lawyer.
The impact has been very massive. As you know, there has been a long history of human rights abuses meted out to people with mental health problems. So in the process, access to justice was equally very tough because first, lawyers could not understand issues of people with mental health problems, but also some of the challenges, because that's the starting point for you to know that because of the complex nature of that is brought along by having a psychosocial disability or mental disability, it's important to try and understand, and that helps to know how to support through the justice system. I think that was very important, that we can have lawyers who are still fresh from school, and then they can be mentored to start supporting the justice system for people with psychosocial mental disabilities. Because when you find many people in the field who are already practicing, there's really very little interest in picking up this case. But I think our experience with Barbara has yielded a lot of good things. We have started a legal desk at Mental Health Uganda. We have also been moving a bit in the field. She has developed referral forms where people can do some small documentation that can then start the process of supporting access to justice.
The program is already good enough. I just think maybe they could add more time to it. 6 months, it ran really fast. And I don't know, maybe perhaps it's because of us who have undertaken it during this particular period of the COVID and the restrictions on movement and everything. But I hope if there's any area for improvement, that should be in the time, in the duration. If it could be pushed much longer, perhaps doubled to a year, that would be more productive in my view.
So NETPIL could devise a way of coming up with a work plan with the organization that is going to host the mentees, so that the activities are intertwined. And maybe in terms of facilitation for community mobilization, I would think maybe NETPIL could increase on the facilitation so that the mentees are actually able to reach out to clients who are out of Kampala, so that we not only restrict ourselves to Kampala, but we also look at clients who are out of Kampala.
Having worked with NETPIL on this particular program, I think it's a very good initiative, and it's a good push-up for people who are just starting out. And so I would appreciate that the period with which people work, because as you're beginning to fit in, they're trying to, that the program is ending. So I would suggest and I would recommend that maybe the time for the mentorship program should be a little longer. Really exposes you to the practical aspects of what you need to know in the disability world.
I appreciate that we are lawyers by training, and this mentorship in its own sense provides another place of being educated, most especially for us who did not undertake this program at our law schools. So a period of 6 months is quite a little small. To make it better, I would propose that we have an expansion on the mentorship period.
NETPIL needs to be giving us lawyers every year. And we are willing to support or work with NETPIL to ensure that this program is sustained, because like I said in the beginning, it's it's not very common to find lawyers pick up interest in pursuing issues for persons with mental disability. So I think we are very energized.
We needed them to find creative ways of using the law to make themselves relevant in those different organizations. The organizations we are talking of are not legal in their mandate. They give psychosocial support to different persons in the area of mental health. And so the lawyers then had the challenge to go and find or make themselves useful and relevant in those organizations. But most importantly was for them to be able to build capacities for the staff or human resource in the different organizations on the law, rights of persons with disability, but specifically and with special interest for persons living with mental health disability.